It's important to remember CPR is effective no matter the cause of the cardiac arrest or the age of the patient. Bottom line, CPR works. In a recent study in Santa Cruz County, it was shown that your chance of survival more than doubles if bystander CPR is performed before emergency crews arrive. The American Heart Association sets standards for CPR training and has released new guidelines for hands-only CPR for bystanders. The new guidelines recommend calling 911 to get emergency crews dispatched and then providing only chest compressions until they arrive. The dispatchers at the 911 call center are trained to provide you instructions over the phone on performing CPR. Recent studies of pre-hospital emergency treatment given to victims of heart attacks show that bystanders are no longer required to perform mouth-to-mouth ventilations when doing CPR. When someone collapses into sudden cardiac arrest, the most important thing is to start chest compressions immediately for the first 4 to 5 minutes. Ventilating the patient can wait. Adults who suddenly collapse and are not responsive are likely to have a sudden cardiac arrest, and their chance of survival is near zero unless CPR is started immediately. Even if the person is not having a sudden cardiac arrest, CPR can still be beneficial by getting them to respond. If that occurs, CPR can be stopped. Otherwise, chest compression should be continued until EMS crews arrive. Remember that dispatchers at the 911 Center for Santa Cruz County can provide you assistance and coaching on performing CPR. To summarize bystander CPR, you place your hands in the center of the person's chest and push hard, push fast, performing 2 compressions a second until emergency crews arrive. As someone considering providing treatment for sudden cardiac arrest in the form of bystander CPR, you should know that California has legal protections in place called the Good Samaritan laws that allow you to perform bystander CPR without fear of being sued. The 2 parts of hands-only CPR are calling 911, then positioning yourself to perform chest compressions. If you come across an unconscious person or see someone suddenly collapse, you need to call 911 or instruct someone nearby to call 911, then perform chest compressions with minimal interruptions. Now that emergency crews are on the way, you will need to start CPR. Kneel next to the patient near their chest, then place your hands one on top of the other in the center of the person's chest. Make sure your elbows are straight and you have your shoulders over your hands. This will allow you to provide chest compressions for 4 to 5 minutes without tiring your arm muscles out. You want to use the weight of your chest and your shoulders to provide the compression rather than pushing with just your arms. You want to be able to compress the chest about 2 inches. Once you're in position, perform chest compressions at a rate of 100 per minute, or about 2 every second. It's important to remember to allow the chest to rebound at the top of each compression so the heart can refill with blood. You don't want your hands to come off the chest. You want them to return to the place they were in when you started the compression. For the first 5 minutes, that's all that is needed. Continue performing chest compressions until emergency crews arrive. Remember that performing chest compressions more than doubles the person's chance of survival. The emphasis is on learning CPR and being willing to use it, not on getting certified. There are online and DVD programs that allow you to learn CPR in your home in as little as 30 minutes.